Hi, my name is Bilal Hasan. I'm an internal medicine resident at Oak Hill Hospital. Uh, Full disclosure, no commercial interests were involved in the submission of this case report. My topic for today is food as medicine, a case of nutritional deficiency presenting as rheumatologic disease. And I'm going to start off with a famous saying by Hippocrates. And he said, our food should be our medicine, and our medicine should be our food. So even historically speaking, it looks like there's always been a link between our food intake and our health, and with disease as well, for that matter. And so I'd like to emphasize, if we have a patient with non-specific joint pain and rash, it's always important to also consider nutritional deficiency, such as scurvy, as part of a broad differential. My patient was a 40-year-old male with past medical history of smoking and IV drug use, and he presented with right knee pain and rash that had been going on for 2 months. On admission, he also had normocytic, normochromic anemia and required blood transfusion. At this point in time, this is a patient with joint pain, rash, and anemia, and our differential diagnosis revolving around rheumatic disease, uh, infection, and also malignancy. But upon closer examination, we found that he had a perifollicular petechia in his right lower extremity, also corkscrew hair. And then around the lower gum line, he also had periodontal erosions. And given these examination findings, now our suspicion is much higher for nutritional deficiency. And indeed, upon further questioning, the patient reports that he has been taking a diet consisting almost exclusively of meat, spaghetti meatballs, as per the patient, for the past 1 year. So further laboratory testing was done. He was found to have a vitamin C level of 0. And the vitamin C supplementation was then started, and patient reported rapid improvement in his symptoms, and he was discharged the following day. So what I'd really like to discuss based on this case is that when we have non-specific joint pain, skin and hair changes, it's very easy to think about only rheumatic disease. And we do recognize that nutritional deficiency such as scurvy is a relatively rare diagnosis in the United States, but it should still be part of our differentials, and that would help in ensuring that the right diagnosis is made and patient care is not delayed. The learning points would be that it's very much possible for nutritional deficiency such as scurvy to masquerade as rheumatic disease. A thorough history and physical examination is essential for diagnosis. In this case, the history of primarily just meat intake for 1 year, and then the examination findings of perifollicular petechia and corkscrew hair were pathognomonic. So that's all that I have for my presentation today. Thank you everyone for watching.